Okay, so let's say this is the affected side. Now remember, you've got your gastrocnemius. Okay, remember we're going to split this in. I say split this in half. We're going to work from the midline across. Okay, and I'll get through to that. So we're going to work both heads of the gastrocnemius and then deep to that. So just remember, so as we're going through, we're going to work from the midline across here to the midline, but I'll go through that. Okay, so remember, no oil, no creams, it's all dry. Okay, so what you want to do, just not too deep to start with. Now you'll see, try not to have your thumbs with sharp angles. I've done this through my acupressure courses, massage courses, but if you're new to this, try to keep, good straight, pretty good, biodynamics with your mechanics. Anyway, what I'm just trying to say is, don't have them like this with a big sharp angle. Don't have them like that with sharp angles. You're going to end up hurting your thumbs. So I can already feel there's tightness in this one. So this is the unaffected side. So you can see what I'm doing. Now remember, if you go too deep, you're going to twang them like a guitar string. It's going to be really uncomfortable. So start up here. We're going to go from proximal to distal, either side. So we're going to just work through, trying to get a feeling. So I'm coming the side of the Achilles. Okay, work your way back up. So just kind of getting a feeling, and this is really just a light version of what we're going to be doing. And you come to this side, same thing. So you're just trying to get a feel of it. It's just very quickly. Just kind of get a feel. You could use your fingers. So remember, the fibers are going along here. So we're perpendicular to them. So, you could use your fingers. Remember, your pads are better for palpation than are the tips. So, I can feel a tight muscle in here. Remember, this is the unaffected side. So I'm going to compare this, not only between sides, but for before and after as well when we're working this side. Okay, all right, so getting a good understanding of this. I'll come from the midline, and I can feel tightness deep into this. There's a tight band in there. So this is very quick, by the way. I'm doing it a little bit longer than I would normally do, because once you get used to it, but if you're not used to it, the person's going to love feeling this anyway as you go through, because you kind of give them a bit of a massage at the same time. As the Japanese shiatsu practitioners say, you must have your eyes in your fingertips, or in this case, your thumbs. So, okay, right. So now we come to here. I've got an understanding of that. So what we're going to do, this is the lateral side, remember, medial side. We've got the lateral head of the gastroc, the medial head, okay? We're going to work on the lateral. So what we're going to do, we're just going to palpate first. So you see my hands, I'm not gripping hard. They're just for support. So I'm just going to take a bit of an assessment. Now this is the same technique you'll be using. So, and if you get closer to the bone here, you end up feeling tighter, generally tighter muscles through here. Okay. Getting a bit of an understanding. I can feel tightness in through here, most definitely. Now remember, as any of my courses, don't just stand here statically. Try and use your body weight a little bit as well. So you're kind of rocking on it. It's much nicer for you and for the client, as opposed to just standing here and just using all just arms and hands. So you have a nice bit of rocking. So both sides, so if I was to work it through here, feeling tight bands in here, these would be most noteworthy because, again, we talk about trigger points and things like that. And referred pain, well, we're really going to be more focused, I would think, on more of this medial side as it refers into this medial side here. But we're still going to work all of the calf. Okay, so again, once you get experience, you don't have to spend so much time, but I'm just giving you an understanding of using fingertips, using thumbs, and I can really feel muscle in there that's tight. That could be the plantaris, tomato, whatever you like, as we go through. All right, so we've assessed it, proximal to distal, distal to proximal, lateral and medial. So now we're going to start on this lateral side and right up, see here, so here's your popliteal fossa up here, so we come up and we're laterally, we're going to rolling over this belly muscle, the muscle belly here to start with. So we're doing this deep friction, not too deep to start with. Okay, and the muscle is rolling under me. You can see I'm not flicking, all right? It's just roll over it. So what you can do is certainly when you start with, if you start here, like if I kept the same pressure and I just went, I won't do it, my son will hit the roof, but it'll be because it's so uncomfortable. And kept that deep all the way through, certainly to start with, it's not going to be comfortable. You'll just twang it. So as you go, you might have to just lift up as you come over. You see that? Certainly to start with. So start in, and I'm just lifting over it a little. So I'm rolling my wrist. If you've done my Bowen therapy course, you'll know exactly what this is all about. As we just kind of lift up as we bring it across. So it's not too strong. Say, if I bulldoze it, it's going to just be uncomfortable. When we get deeper, these muscles start, the superficial muscles start to soften up. We can get deeper, and we do want to get, you know, as I said, we've got to explain to the client, it might be a little bit uncomfortable. Let me know if it's too much. So there's a tight muscle right there. I can feel it. So I'm just working through there. So we concentrate the lateral body, the lateral head of the gastroc, and deep to it all the way down. So if you split this in half and the Achilles tendon up through between the two heads here, we're going to work this head to start with. So we're just working through, and again I can feel tightness in here. Like I said, when you get closer to the bone, the structures here, you can. So, and we're coming the side of the Achilles. Now you might want to work the Achilles itself, but we absolutely want. Remember I taught you about earlier on in the course, the muscles come down and around. Okay, and that's, yes, they come into the Achilles as well. So along the side of the Achilles, go deep into that. This okay, Liam? Okay, so you get your feedback, just feedback from your client. Okay, proximal, distal, distal to proximal. Now, we're going to be working the calf for 10 minutes or so doing this. So as we work that, okay, and I'm starting to put more pressure on now because I know that the muscles are more forgiving, the client's used to my pressure, and I can feel this tightness down here. So I'm going to be working, you can probably see my thumbs, and there's another little spasmy muscle in there. So I can do sort of if I find that little muscle in here, I can do just a little work over that one, coming up to the knee there, just like there's the crease. So we're coming up to the tendons there, work our way down. So I'm doing so. If you look at the difference, now I don't want you to get confused, but as you just get through, you can do like sort of larger sweeps over the whole gastroc, if you can imagine that sort of feeling. So you see how I'm doing a nice lateral head of the gastroc. You see that, work my way down. So this is deep friction massage, right? Okay, so we do that, and then we'll go back up again. Okay, so fairly broad over it. You can see I'm going over it. Look at my thumbs. See, you can see that. Up and over I'm going. Okay, and now if I want to go a bit deeper now. Now generally, but I'm just going to show you this, I would do that, and then I'd keep that same pressure as we go across the other. But I just very quickly show you. So if I want to go then deeper, Liam, you let me know if anything's too much, love, okay? So that's exactly what you do with your client. So, and you say to them, look, you've already told them anyway, might be a little bit uncomfortable, but let me know if it's too much. So now I'm working, I can feel there it is there, a little tight muscle there. That's okay, pal? Yep. So I'm now doing the same thing at a deeper level now. And my nearly 14-year-old son is absolutely fine with it, even though I'm working deep now to these muscles, deeper down, feeling for those tight bands deeper down, and we keep working across them. Yeah? And done well, this will feel nice to the client actually. It might be a bit uncomfortable at times. Right, so now we've done from the lateral side of the leg, the lateral belly, and muscles and tendons deep to it, right? Okay, so you've done that. Now, what we've done, or what we're going to do, so if you say it took about 10 minutes, so if we divide that into quarters, because then we're going to come from the other side after that, 2.5 minutes each side, each one. So that would be 2.5 minutes if you want to get really, oh, how do I break this up? So we just break it into quarters. So now we're back in the midline. So we've done from this side to the midline basically, and now we're going to the midline, medial head of the gastroc. Look at your anatomy if you need to. You know that's two heads there, gastrocnemius. So now we're starting from the medial head, and again, don't go too deep yet. And it is more tender generally, more sensitive on this medial side. So you can see as we work, and I can feel tightness in there. And you see I'm on the medial side of the Achilles tendon. And not too deep to start with. That okay, pal? Yep. I can feel again, it's probably that plantaris. It's hard to know the exact ones, but I can feel it. You'll feel it in there. And that could very well be that plantaris muscle as it comes down. Well, you can see that, look. See, I strum that, you can see that coming underneath. So, midline to the medial side of the head as we go. So we're starting in the midline, and away we go. Now I can feel that there. So you're exploring as you go through, you're treating and exploring tightness. Okay, so we start off, now we're going to work a little deeper. Same thing, I'm starting off in the midline. So you start to work deeper. Now I start to feel more, so starting to go on those bands there. Again, once you get used to this, you will know, it'll be just become more and more easily, like any skill. You can see with Liam here, so I could, I don't have to use my thumbs. We get small areas, I can use my fingers. As long as I feel it coming underneath, which I do, coming underneath my fingers, broader areas, more thumbs. So you can see what we've done. We've broken it up to two sides. We're coming from the lateral side of the leg. We're going this side, proximal to distal. Whoops, sorry, Liam. And then starting from the midline and doing that. So all the directions are going across towards your midline, the medial side. We've just broken it up into two halves. Okay. So just going on this side again, and on this side. Okay. So once you've done, say, 5 minutes of that, then we're going to come from this opposite side and we're going to do the same thing, but the direction is becoming this way. So we're going to go like that. So, as we work through, again, I can feel, I don't know if you can see it, but you probably can actually. Feel through there. Again, just remember, so you start off not too deep. Work your way. The first few are really treating but also exploring as well. Okay. So the muscle gets looser. Your fin can get into a little deeper. And now, let's have a feel through this. There's a deep down here. I can feel that there. So I just want to roll over it. It's a deep band in there that's very tight. That's okay, pal? Yeah. So now, you can see my pressure nice and deep, but not uncomfortable. It doesn't have to be uncomfortable, but you're working. And there it is there. Okay, and now we'll go to the other side, the other gastroc here. So once again, what we're doing from the midline, and then, oops, oh, it's hot in here, I'm starting to sweat. Okay, start off just gently at the start. You see I'm rolling over the gastroc. Again, I'm feeling tight bands through here. Work our way right down the side of the ankle here, on the lateral side of the Achilles. As you can see here, feeling all the time, feeling for deeper muscles when you can. The deeper and tighter muscles as you work through. Okay, so those are the deep friction techniques for the posterior calf muscles. Remember, you start off and then you work deeper as you go along. Now we also want to address the lateral and the anterior muscles. So you get the person to, you could turn them on the side, but I just think you just do it very easily, having them turn onto their back. So that's what you do. Now you get them to turn over supine, because we're going to get balance, because remember, we've got agonist, antagonist, opposing muscles, posterior. We also want to balance out the anterior muscles at the same time.